From the minute it happened, I was so sick. I had a huge bump on my head. I got in the car, I didn't even know where I was. And then I had a family member bring me to the hospital. And then there was quite a few tests before they realized that I had a vestibular concussion.
By far the most common symptom after a concussion is a headache. But if someone's forgetting their name, forgetting family members, that's a much more serious condition. Hi, my name is Rick Purdy. I'm a physical therapist, and I started to specialize in concussion and vestibular rehabilitation in the very early 2000s. A concussion is an injury that is caused by a rapid acceleration-deceleration of the brain within the skull. It's believed to be a metabolic issue where your brain is utilizing resources, its nutrients, abnormally. Symptoms of a concussion can look like someone who has a migraine or someone who is in a mental health crisis.
I was experiencing severe headaches, severe nausea, severe vertigo, dizziness. All of a sudden, I could be looking at you and my head would just start going for no reason. I had no control of that.
In the past, frequently people were told, stay in a dark room, don't do anything until you feel better. And what has been found is that people take a much longer time to recover when they do that. Patients receive treatment based on their evaluation. We find activities that are bothersome, and we try to find a way of working those in a way that does in fact increase the symptoms, but not severely in intensity and not for long in duration. If someone has visual or vestibular, which is inner ear problems, there are exercises for those as well.
When I came here, we worked on so many things. There was a series of exercise to teach my body to fix itself.
Shortly after a concussion, light exercise increases cerebral blood flow, which actually assists with the recovery after a concussion.
The MD doctor was not helpful at all, because all he wanted to do was give me pills. The therapist here had to put together an enormous amount of work in order to find out what would work for me. And they stay committed to me.
It's also important to make sure you're continuing to have a healthy diet, eating well, staying well hydrated. That also involves avoiding certain things, such as alcohol. Concussions should, by definition, never involve a permanent loss of function. After therapy, the goal is to have returned to full function without any symptoms.
My therapist here is my hero, because I would not be where I am today.